Rural healthcare is facing a crisis nationwide. Facilities closing, staff shortages, or suffering from a lack of funding. Our investigative team is looking at how small facilities are trying to recruit nurses and doctors, which is no easy task. Jeff Van Sant has the story.
Living and working in small rural communities is not for everyone. And that's the problem when it comes to keeping medical professionals. It's hard to bring in doctors, nurses, nurse practitioners to hospitals like this one in Binkelman, a town of around 900 people.
It's just that mindset that we're in the middle of nowhere and we're critical access and nobody wants to work here.
Lycan Verbis is the chief nursing officer at the Dundee County Hospital. It's about getting creative. It's not just enticing a doctor or a nurse, but their families.
You know, we have to sell the town as well as the facility. You know, we just try to tell them what all we have, and I don't know, we try to sell it the best we can.
I mean, they may fall in love with our opportunity, but their spouse does not fall in love with our community.
Rita Jones is the CEO.
Even though you're out here where you don't have a lot of the amenities that you want, you're not isolated. It's easy to get someplace.
It does take some convincing. Nebraska and the federal government offer loans and payment programs for medical professionals working in rural areas.
It's one of their biggest recruitment and retention tools. We actually did a study last year looking at family medicine providers across the state, and for especially rural and small towns, it showed a significant increase in retention by having the loan repayment program there.
The Health Resources and Services Administration says 20% of Americans live in rural areas, covered by only 9% of physicians nationwide. Fewer than 1% of final year medical residents prefer to practice in small communities.
I'm from rural Iowa, so I knew what I was getting myself into, so to speak.
Dr. Janine Wedeking, a third-year family medicine resident at the University of Nebraska Medical Center, spent over 2 months working in the small town of Lexington.
We have sufficient training to kind of run independently. So, how have things been going since Friday? Since I saw you? Yeah?
Yeah.
So you see a patient in clinic, you've delivered their baby. Well, you might see their cousin, and you might see her husband, and you might see the grandma, and you may see them at Walmart.
Does she seem pretty satisfied after feeds?
It's hands-on. She's there to boost staff, some who have been overworked, even delivering over 30 babies in her short time here.
It's a lot of days I have full clinic schedules, so I think I've probably seen over 500 clinic patients in the past couple of months. Yeah. So I've been pretty busy.
Dr. Wedeking plans to make rural medicine her life.
She looks like Dad, doesn't she?
She does. She does.
She loves it.
Okay, perfect. You are the doc in clinic. You are the doc in the inpatient ward. You're the one delivering the baby. You're potentially the one covering the ER for the weekend. So it's certainly a huge commitment, but certainly huge reward.
She's an exception. It's a hard job selling small-town America. But it's a struggle rural medical professionals keep improving.
We've gone to educational things or job fairs and tried to pull in people, but it's hard to get new nurses to believe that they're not just going to be stuck out here in the middle of nowhere. Like, they all want to be specialized, or they all want to, that's too small for us, we'll be bored. But we're never bored here.
No, never bored. Well, Jeff joins me now. You've looked at a wide range of issues facing rural healthcare. What has stood out to you as you've been reporting on this?
Well, I think the overall message that I'm hearing from a lot of the CEOs that run these small facilities is that things really began to take a turn for the worse when the Affordable Care Act went into effect. They say that it kind of focuses more on the urban areas, and that rural health kind of got stood outside, and a lot of these regulations have caused them to have cost increases, and so that has obviously affected their staff numbers. So it's kind of gone all over the place, but that's one of the main things that they say is the issue.
Yeah, you were talking about recruiting. They were talking about recruiting there. What more are they doing in that area?
Well, that's what's kind of interesting. They've always come up with all these incredible ideas to try to bring some of these people, because, a small community is not for everyone.
Right.
It really isn't.
No.
I mean, if you just, if you like that hometown feel where you know everybody.
Sure, some people might love it.
That's fantastic. But one of the ideas that they're working on kind of across the country is they're trying to bring in some foreign doctors. And so when they do that, they're kind of offering them kind of a expedited green card. So that's actually kind of interesting.
Oh, that is interesting.
Yeah, so I mean, they'll try to entice you to come to these rural communities, be like, hey, we might get you through the immigration process quicker if you move here.
Yeah, hadn't heard about that. So from what you've learned, what you've been looking at, where do you think rural healthcare stands now? Is it in a good position for the future?
I mean, it's such a complicated.
Yeah.
I mean, we've gone through 4 or 5 stories talking about the number of issues here. It's not as easy as people think, but I think it has to evolve. And the problem is that a lot of these communities are getting older. They're not getting younger. A lot of the younger kids are going to the bigger cities, like coming to Omaha or going to Denver or whatever. But they're coming up with different ways. They've got the telehealth, things like that, but it's so complicated that I can't give a clear answer on that one.
Sure, no one really has that answer.
No,
And
I mean,
so
they're testing everything they possibly can, and some things stick and some things don't.
All right, and I'm sure it's something you'll continue to cover, especially if they come up with different ways to try to recruit or deal with this issue.
Yeah, for sure.
All right, thanks so much, Jeff. And to see all of the stories in the investigative team's rural healthcare series, visit our website, that's 3newsnow.com, and click on investigative. And if you have a story that you want our team to look into, email us at investigative@3newsnow.com.